Okay, so in this video we're gonna cover parasympatholytic medication, and like before learning any ANS medication, I really want to review this chart, so we know like what effect the parasympathetic nervous system has on our body and what does the sympathetic. So in this one, we're gonna focus on this one. So parasympathetic nervous. So we're gonna talk about the drugs that goes and bind to the parasympathetic receptors and blocks them, and blocks their activity. So whatever is happening when you looking at here, whenever is happening when you excite the parasympathetic nervous system, it's gonna happen the exact opposite thing. So let's say if it is gonna decrease heart rate in parasympathetic, the parasympathetic medication that blocks the receptor is gonna increase the heart rate. It gonna cause the relaxation of bronchial muscles, constriction of arteries, and so forth. So it's like totally opposite effect of the parasympathetic nervous system on our body, because we are blocking parasympathetic nervous system's receptors. Next slide is just showing the main neurotransmitter for the parasympathetic nervous system is acetylcholine. Parasympathetic nervous system has two receptors: muscarinic receptors, nicotinic receptors. Muscarinic receptors are present in the heart and all other parasympathetic targeted organs, and nicotinic receptors are present in the smooth muscles. This is the really important thing to remember, especially for the parasympatholytic medications. Okay, by the nicotinic and muscarinic receptors, nicotinic in the smooth muscle. Alright, let me see. Alright, so the parasympatholytics medication. First, in this categories, we're gonna talk about the medication that goes and blocks the muscarinic receptors. We're not talking about the nicotinic right now, the only muscarinic. So it will not have any effect on the smooth muscles, as we know the nicotinic receptors are present in only smooth muscles, while the muscarinics in the heart and all other targeted parasympathetic nervous system receptors. Okay, so this blocks the muscarinic receptors of the parasympathetic nervous system, and we're gonna talk about each drugs in this category. The first ones are really important drugs is atropine. Okay, atropine has a wide variety of use. The first one is to increase in the heart rate. So if you know the ACLS algorithm or the medication, the atropine is really main one. Like you give this medication for bradycardia to increase the heart rate, to inhibit the vagal response. Can give this medication in order to dilate the pupils. Now when we block the parasympathetic nervous system, it's going to relax the GI, and GU is going to slow down. So we can give this medication for relaxation of GI and GU system. And also, as we talked, if you have reviewed the parasympathomimetic drugs, there is a class, it's called indirect acting parasympathomimetic drugs. And whenever there is a poisoning of indirect acting parasympathomimetic drugs, the heart rate goes down, and in order to bring the heart rate up, atropine is often used as an antidote for the heart rate. So that's the important thing to remember. Atropine. Scopolamine, that's a drug. It's used to decrease the GI motility, to decrease the nausea and vomiting associated with the high GI motility, and also for the pupil dilation. Benztropine and trihexylphenidal, that one's also to reduce tremors and muscle rigidity in Parkinson's disease. So this actually relaxes the whole skeletal muscles thing, and very often used. The benzotropine is very often used for the relaxation of muscles if they're having muscle spasms. Ipratropium and tiotropium is used for asthma. Now that's another thing to remember about these drugs, is this one is used for asthma management. Now, what does that mean? If you know about the albuterol, That's the symphytomimetic drug. Albuterol has a really it works really fast, like it works in minutes. So if someone has having asthma attack, you will give albuterol. You cannot give ipratropium and tiotropium because these drugs will take about 15 minutes to start working. So these medications are used for the asthma management, not for the asthma attack. That's the important thing to remember. Okay, ipratropium, ipratropium, and tiotropium. Oxybutynine is for incontinence. Like a parasympathetic nervous system, it actually increases the urinary systems and it contracts the urinary bladder. But when you block that parasympathetic nervous system effect on the urinary system by giving these drugs, it will decrease the contraction and it will decrease the incontinence. That's the other this drug's tolterodine. That's also for overactive bladder and urinary urgency and frequency. It's been used like if someone's having urinary urgency and frequency, this drugs actually will decrease the urgency and frequency as well. It works on the urinary bladder well. Now, side effects. It's the same thing. So if you're giving a drug, let's say to treat something urinary frequency and urinary urgency, now this drug is also going to go to a different organ and going to bind to parasympathetic muscarinic receptors and going to block that one too. And that effects are basically the side effects. Let's say the drug, let's talk about the drug. For example, oxybutynine, this one. You give this one for incontinence. It should work on the urinary bladder, but at the same time, it will go to the heart and blocks the parasympathetic receptors that will increase the heart rate. It will go to the eye and it will constrict the pupils. It will dilate the pupils and it will cause the increase intraocular pressure. It will decrease the salivation because it's going to go to the salivary gland and block the parasympathetic nervous system. So it's going to decrease the salivation, going to cause the dry mouth. So it's basically those effects on the other organs that we do not want, but we do not have any control over it. It's the side effects. So blurred vision, increased intraocular pressure, weakness, dizziness, insomnia, and confusion. Dry mouth, nausea and constipation, heartburn, paralytic ileus because it's going to go to the gastrointestinal system. It's going to slow down the GI system as well. It can cause that one. Can worsen the urinary hesitancy and you can cause the urinary retention as well. This medication, as I say, is going to go to the heart and going to block the parasympathetic nervous system receptors, going to increase the heart rate. It can cause the heart palpitation and cardiac arrhythmia as well. So those are the side effects for these drugs. Now, we talked about blocking the muscarinic receptors. So the parasympatholytic are blocking all the previous drugs blocks the muscarinic receptor. Now, what if we block the nicotinic receptor, which is present at the smooth muscles? What it will do? So this medication, another class, falls under the parasympatholytic medications. They block the nicotinic receptors of the parasympathetic nervous system. That's why it's also known as the neuromuscular blockers. Now, when it blocks the nicotinic receptor at the smooth muscles, it will paralyze those smooth muscles, basically. Like any voluntary and involuntary, both. So actually it will cause this. That's why they're also known as a paralyzing agent as well. And they're oftenly used with the anesthesia, like for the intubation. If a patient if they're on the ventilator and they're fighting ventilator, then they will give this medication to paralyze them so they do not fight the ventilator and increase their respiratory system function. But it has to be used under the supervision of physician, and they're not really oftenly used in ICU They're more used in operating rooms, OR and IR. There are different categories in this too, is depolarizing agent and non-depolarizing agent. I'm not going to go in detail of this each mechanism of action for depolarizing and non-depolarizing because it's too in depth, and as a nurses we don't really need to know. But just remember there are two different types. There are two different categories. If this neuromuscular blockers, depolarizing and non-depolarizing agent. Depolarizing agent is succinylcholine chloride, and non-depolarizing is atracronium, mevacronium, pancuronium. So it has all chloronium mostly. It has the same suffix. Rocuronium, tubicuratin. That's the only different one, but mostly they have the same last 4 or 5 letters. They're used mostly for paralyzing agent for surgical procedures, or also they're used for depolarizing agents for the patient receiving electroconvulsive therapy to paralyze them as well. What are the side effects and contraindication? It causes the persistent paralyzing status, obviously, and depolarizing agent, because of their different mechanism of action, it can cause the hypotassium level, and it can cause the malignant hyperthermia and muscle pain. Now, here's the main thing to remember as a nurse. Malignant hyperthermia. It's not like increase in temperature of patient to 101 Fahrenheit or 102. But the patient temperature will go like 105 Fahrenheit right after they come to the surgery or after a couple hours. So that's why it's really important to watch patient's temperature when they come back from the surgery, if they have these agents, if they had received these agents. And basically malignant hyperthermia is an emergency, and you need all the help. In malignant hyperthermia, you give dantrolene sodium medication. It's basically anesthesiologist or certified registered nurse anesthetic will run this code, malignant hyperthermia, and you definitely you give ice saline in order to decrease the temperature of patient. You put ice bags, cooling blanket, dantrolene sodium medication that prevents the tremors and shivering, prevents the muscle breakdowns. It's really an emergency, and as a nurse you really need to know what to look for whenever you have a patient having malignant hyperthermia, and it's really emergency. You need to act in within minutes. So these are about the information about the parasympatholytic medication. I hope you understood them very well. But if you have any questions, let us know, and thanks for watching it.